Ladies and gentlemen, Ladies and gentlemen, welcome to the Consumer Advisory Committee's Recruiting, Training, and Retaining Members for Engagement webinar. This conference is being recorded. My name is Angela George, and I'm with the Lewin Group. This is the first webinar in the 2016 Meaningful Member Engagement webinar series. Today's webinar is titled Consumer Advisory Committees, Recruiting, Training, and Retaining Members for Engagement. Next slide, please. Please contact rick@lewin.com if you have any questions or additional comments. Before we get started, I'd like to remind you that all microphones will be muted throughout the presentation, but there will be a brief question and answer opportunity at the end of the presentation. If you do have a question, please use the Q&A feature on the WebEx to submit a question at any time during today's event. Next slide, please. This series is presented in conjunction with Community Catalyst and the Lewin Group and supported through the Medicare and Medicaid Coordination Office at the Centers for Medicare and Medicaid Services. MMCO is developing technical assistance and actionable tools based on successful innovations and care models such as this webinar series. To learn more about current efforts and resources, please visit our website, www.resourcesforintegratedcare.com, for more details. All of the Q&As, the slides from today's presentation, and a recording will be posted to this website. At this time, I would like to introduce our moderator. Rosa Palacios is a Consumer Engagement Specialist with the Center for Consumer Engagement and Health Innovation at Community Catalyst. Prior to joining the center, she served 12.5 years on the staff of Commonwealth Care Alliance as the director of CCA's Department of Health Education and Caregiver Training. Rosa holds a T-Trainer certificate for the Chronic Disease Self-Management Program and a Master Trainer certificate in the Diabetes Self-Management Program in both English and Spanish, issued by Stanford University. She is also a Master Trainer for the Healthy Eating for Successful Living in Older Adults. Rosa recently graduated from the National Practice Change Leaders Program and the Massachusetts Institute for Community Health Leadership Program and was awarded the Emmanuel and Lily Schnabel Scholarship at Harvard University Extension School in Cambridge, Massachusetts. Rosa?
Thanks, Angela, and thanks everyone for joining this afternoon, and for those of you on the West Coast for joining in this morning. As Angela said, I'm with the Center for Consumer Engagement in Health Innovation. The center is a hub devoted to teaching, learning, and sharing knowledge to bring the consumer experience to the forefront of health. The center is part of Community Catalyst out of Boston, Massachusetts. If you want to know more about Community Catalyst and the work of the center, please visit our website, www.communitycatalyst.org, and follow the center on Twitter at CCEHI. First, I would like to introduce you to our platform for this session. We have with us today Jacqueline Dowdy, a member advocate ombudsman for Neighborhood Health Plan of Rhode Island. She has been employed at Neighborhood Health Plan of Rhode Island for the past 16 years and acts as a bridge between its members and the health plan. Prior to her employment at Neighborhood, she worked for Thunder Mist Health Center in Woonsocket as the coordinator of school-based health and opened the first elementary school-based health center in the state. Jacqueline received her master's degree in social work from Yeshiva University in New York, in 1996. Jacqueline believes strongly in community and family. She is the past president of the board of directors of the Rhode Island Foster Parents Association. Jacqueline is also the proud adopted mother of 2 young girls, ages 12 and 13, both of them with special health needs. Bringing the consumer voice today is Serena Simeone. Serena has been a member of Neighborhood Health Plan Rhode Island for several years, initially in the right care line of business with her children, and eventually she became a dual and joined the Duals program since its inception in 2013. Her children continue to be part of Neighborhood Health as well. Serena is very active on Neighborhood Health Plan Rhode Island Member Advisory Committee, by its initials MAC. She has brought other members to MAC, as well as brought the problems of other neighborhood members so that they could be assisting in solving their issues. She is a true advocate. Serena was raised in San Diego, California, and has 3 children. Caitlin, 12, Christopher, 9, and Braden, 4. Serena has 1 brother and 1 sister, but she is the baby. She lives in Johnston, Rhode Island, has a children's birthday party business. She dresses up in characters. And she also volunteers at Hasbro Children's Hospitals, Tomorrow's Fun, Pennies for Paws, and Animal Shelter in North Kingston. She loves working with children, and she loves Neighborhood Health Plan of Rhode Island. And she said in her own words, and I quote, "I will never leave Neighborhood Health Plan of Rhode Island." Then finally, we are joined today by Margot Michaels, Director of Consumer Engagement at Healthcare for All. Margot Michaels comes to Healthcare for All with more than 20 years of experience fostering consumer engagement in healthcare research and policy efforts. Her background is in developing innovative patient and public education, cancer patient advocacy, health professional education, and quality improvement to improve access to care, in particular for minority groups. Margot was the founder of the Education Network to Advance Cancer Clinical Trials, by its initial ENACT, a national advocacy organization focused on increasing participation in clinical research through community engagement. She has served in many positions at the National Cancer Institute, the Susan Komen Foundation, and the National Breast Cancer Coalition, and as independent consultant for numbers of companies and nonprofit groups. She holds a Master in Public Health in Health Behavior, Health Education from the University of North Carolina, Chapel Hill School of Public Health. She is pleased to bring her strong commitment to social justice through community engagement around healthcare issues to Healthcare for All. Next slide, please. Today's agenda for this webinar is right there before you. We are going to start off with myself giving a brief overview of meaningful consumer engagement. What is it and why does it matter? Then I will talk a little bit about the consumer engagement toolkit that we have developed for health plans and other delivery systems, and the technical assistance and consultation services that we provide at the center, as well as to our consumer advocates across the country. Then I will take a couple of polls and have our speakers present from their health plan's perspective on successful recruiting and retention strategies for consumer advisory committees. And we will have the consumer perspective on those approaches from Serena Simeone. Our last speaker, Margot Michael, will guide us through the training process, and we'll conclude the webinar with one more poll, and then we will move to questions and answer period. Next slide, please. So let me just talk a little bit about meaningful consumer engagement, the basics of why it's important, and what we mean by meaningful consumer and engagement. When we talk about meaningful engagement, we're talking about making sure that your advisory committees have a meeting agenda that's developed with collaboration from your members and is communicated to them in advance of the meeting so that they have a structure for what's going to be discussed at the next meeting. It also means that you're getting personal as well as representative stories from your members on an ongoing basis. That feedback should really be about how they're experiencing their health care and how they are hearing in their communities what others are doing. It also means that the advisory committee is diverse and has diverse representation across the enrollment population. So that goes across the board when it comes to age, gender, race, sexual orientation, languages spoken, disability type, diagnosis, the whole gamut, as well as the folks who are invited to and participating on the advisory committee are not tokenized in any way, that the plan is not checking in a box, that they have an advisory committee, and that the advisory committee has met 4 times a year. For instance, the folks that attend should be valued. Their time and their input should be truly valued and listened to. Again, because they're offering these meaningful personal stories. By consumer, what we say really is that the focus is on the member and the caregiver that you have assembled on your advisory committee, and that the focuses of the meeting are not solely member education and staff presentations. We have seen that there are some plans that are doing advisory committees where the consumers have a very small role on the advisory committee, and their input is not as strong and their voice is not as strong on those committees. So that we would really recommend that the focus on these meetings be on the member and the caregiver, and not as much on staff giving presentations to each other or to the members. The consumers that are on there is the focus. The advisory committees are truly engaging when there is active listening going on. That means there is reflecting feedback by the facilitator on what they're hearing from the members, and that there is a really true dialogue about what the members are trying to relate to the plans in terms of how things could be improved. It also means that the plan should develop a feedback loop in which the input of the consumer is communicated up the chain in command through senior management and executives and board of directors, so that there can be some results, some outcomes to their feedback. In summary, meaningful engagement is purposeful because it provides consumers with a relationship that allows them to achieve their respective goals, and is supported by the organization in a way that respects patients' interests and uses their expertise. It's also effective. It means that the participation of consumers is impactful on programs and is also an integral part of achieving the organization's vision and mission. And the last one, equitable. Engagement and representation are balanced. Consumers are offered equivalent opportunities and activities and shared decision-making as it relates to the organization's work. Of course, we know plans cannot do everything. So then, of course, when a plan cannot do what a consumer is asking or what the advisory committee is asking them to do, some kind of explanation as to what the reasons are for, that will be really helpful. It just helps people to realize and understand that their feedback is being listened to. Next slide, please. Again, like I said at the beginning, we at the center have developed a consumer engagement toolkit to help health plans, provider groups, advocates, and consumers implement consumer engagement strategies. We also offer technical assistance and consultative services around strategic planning for recruitment, retention, and support, consumer trainings and leadership development, as well as user-friendly tools, on-site assessment, and gap analysis of engagement strategies. The speakers today have been instrumental in helping the center develop these tools. If you want to know more about the toolkit and other consumer engagement strategies, please visit our website, www.communitycatalyst.org, and follow the center on Twitter at CCEHI. Next slide, please. Now, before I hand the presentation over to our first speakers, I would like to take a quick poll to see the types of organizational representation we have today. Please indicate the type of organization based on the choices provided. Angela, can you see the results?
Yes, we can see them.
Can you please say out loud what the results are?
We're closing the poll at the moment, and we'll be right with you with the results. So 46% are health plan staff, 3% are healthcare providers, 5% are consumer advocates, 5% are state or local government, 4% are community-based services, and 5% are others.
Thank you for your participation. Now let's take another poll, number 2, to see how many of you are already using recruiting strategies for your Consumer Advisory Committee. Please take a few minutes to submit your response. Angela, do we have the results?
Yes, we're closing the polls, and we'll have the results shortly. So 18% stated that they recruit members with telephone call outreach. 10% stated that they recruit members by referrals from member services and/or providers. 12% stated that they recruit members by referrals from care or service coordinators. 7% indicated that they recruit members by referrals from consumer advocates and/or community leaders, and this includes civic or religious groups. 5% indicated that they recruit members with advertisements like websites, member newsletters, flyers, etc. And 45% had no answer. Thank you.
Thank you so much for your participation. Now I'd like to hand things over to Jacqueline Dowdy to get us started. Jacqueline?
Good afternoon. My name is Jacqueline Dowdy, and I want to ask you to please forgive me for my voice. I'm losing my voice. And I'm the member advocate for Neighborhood Health Plan of Rhode Island. Next slide, please. So Neighborhood Health Plan of Rhode Island began a program called Integrity. We had our MOU signed with CMS on July 30th of 2015. It is our Medicare and Medicaid plan. We are probably the only state in the country that did an integrated care initiative in 2 phases. Phase 1 we've called Unity, and Unity is our Medicaid managed care long-term care. Enrollment began on October 1st of 2013, and we had approximately 22,000 enrollees. We have approximately 600 Medicaid-only enrollees. Phase 2, we're about to begin on July 1st of this year. We are happy to admit that we do have 3 new enrollees, and we can't wait until we start that program officially in July. Enrollment for that part of the program will go from July 2016 until March of 2017, and we're anticipating over 11,000 enrollees. Neighborhood for a very long time has had a commitment to consumer engagement. We've been running advisory committees, myself and one of my colleagues here at Neighborhood, for about 12 years. Our commitment is shown through our member advisory committees, or MACs, and we also believe that in order for there to be a true commitment to these MACs, you have to have dedicated staff in order to run these member advisory committees. Next slide, please. When we begin our new integrity member advisory committees, we will be meeting 4 times a year. Currently, with our other advisory committees, we are meeting approximately 5 times a year. We will, with them, as we do with the others, provide a stipend and a meal. We found in Rhode Island, if you feed them, they will come. So we always want to provide a meal. Transportation can also be provided and arranged if necessary. And we try to encourage folks that if they are able to get here, that they use their own transportation, but certainly if they need it, we will arrange for it if it's necessary. The groups are structured as follows. Myself, the member advocate, and one of my colleagues, the manager of external affairs, Kenneth Palacios. We are the 2 that run the groups. As I've said, we've been running them for about 12 years. Our current RHO Member Advisory Committee is a mirror of our current RHO member population. And we thought that that was extremely important so that the members on our committee would be a good representation and be able to talk for the members of that particular population. Next slide, please. Recruitment. Recruitment, we do quite differently than we did when we started this 12 years ago. 12 years ago, we invited a bunch of people into our cafeteria and we did interviews, and we had about 50 or so individuals show up. We fed them, we interviewed them, and that was how we made our first groups. But now what we're doing is most of the members that sit on our advisory committees come through myself, the member advocate. I either will speak with them on the phone because they've had an issue and they've been referred to me by, say, customer services, or another member from one of our groups would think that they would make a great advisory committee member, so they'll refer them to me, or they'll see an ad or something about our advisory committees and just give me a call and want to find out more information about it. And so what I'll do is I'll interview them. Another way that we recruit for these advisory committees is through community events, whether it be a health fair or some other event. We have a lot of different things in the park for the elderly population, so we will recruit through those events as well. We also get referrals from other advocates, professional advocates that are our community partners, and they will say, you know, I've been working with this family or this individual, and they are great advocates for themselves and their children, and I'd like for you to see if they could fit on one of your groups. And so that's what we'll do. We'll bring them in that way as well. We also have a very large medical management department here at Neighborhood, and they spend a lot of time on the phone with our members. And so we also get many of our MAC members from our care managers. They'll speak with them, you know, and they just have this good feeling about them on how they have just been, you know, such great advocates, again, for themselves or their children or other family members. And they'll say, you know, Jackie, I told them about one of the committees that you guys are running, and the person is interested, so either they'll call me again and I'll interview them, or I will call them. And then it's always big with word of mouth. You know, members that currently sit on the advisory committees, they always have a friend or a family member. Could I bring in this friend? I think she'd be great for Children with Special Health Care Needs committee. Or could I bring in a friend? She's another foster or adoptive parent. I think she'd do really good on that advisory committee. And so word of mouth works really well. And then finally, we also have ads in our neighborhood quarterly newsletter. And that also will yield in many calls when that goes out as well. Next slide, please. So retention. You know, we've never had a problem with retention. We've had people, you know, that we've had to ask to step down from our committees because they've been on our committees for so long, you know. But the members that are currently on our committee, they really feel as though they're there and they're making a real difference and a contribution to the health plan. One example of that is with our board committees. And so, you know, we've had members come to us and they've said to us things like, if we're really going to make a difference on this advisory committee, why can't we sit on the board of directors? Why can't we be a part of the board so that we can help to make a difference? And we brought that back to our senior leadership here at Neighborhood. And as a result, we now have 4 members that have been chosen to be interviewed for our board planning committee. And from there, one will go on to our larger neighborhood health plan board of directors. So we feel really good about that. And another issue was transportation. Transportation has always been a big issue in Rhode Island. Although it's a very small state, things are far away. And so transportation is also very difficult. And so we found that the state was allowing for some of our members to go to Boston and other places to see specialists, but they didn't have a way for them to get there. So they would give them a taxi to go from Woonsocket, say, to Providence, which is only 15 miles away, and then give them permission to see a doctor in Boston, but then they wouldn't have transportation to get there. So the members on our advisory committees, they really, really stood up for that, and they said, if you're going to allow us to go to Boston to see doctors, then you're going to have to help us to get there. And as a result of that, the state heard them. And we are now providing transportation for our members to get back and forth to their doctor's appointments in Boston and other places in Massachusetts. Another thing with retention is I really believe that our members enjoy the connection that and the camaraderie between each other. They truly do become friends. I love to use the example of a woman that has been on our advisory committee for quite some time, and she has an autistic child. And she would always say that, you know, she had a very difficult time finding time for herself or going out alone or just having some silent time, some quality time alone or with her other younger child. And so she made friends with one of the other committee members, and now this woman will babysit her child with autism. It allows her to spend time alone or with her other child, and their friendship is just one that is wonderful. I love to see them when they come in together. Another thing that we believe in here in Rhode Island is if you feed them, they will come. So we always provide a meal and a stipend. And we provide the stipend because we really believe that they are bringing us valuable information. And although they're not employees of Neighborhood, but the information that they bring us is that valuable, that we believe that providing them with a stipend is worth it. And finally, but I also think most importantly, is that the members have truly, truly developed a relationship with myself and my co-facilitator, Ken. They call us when they have issues going on. They call us just to talk sometimes, and they have really began to trust us, and they think that, you know, if anyone can get it done or if anyone can help me, Ken or Jackie is the person that can do it. And so we really, truly believe that that is one of the main reasons why our members continue to come, because of the relationships with myself and with Ken. And before ending, I just want to say thank you so much for having me here today. And I'll be here for questions and answers at the end. But right now, I would like to turn it over to Serena. Serena is a longtime member of Neighborhood's Member Advisory Committees.
Good afternoon. As Jackie said, I am a longtime member of Neighborhood Member Advisory Committees. I have probably been a member of each of the committees, and my family and I have changed from one line of business to another. I believe that the first committee I began with was Right Care, Neighborhood's plan for moms and kids. The way I became involved was one day I called into member services with an issue. The representative I spoke with suggested that I speak with the member advocate, who I now know as Jackie. After speaking with her about my issue, she said to me, "You are a great advocate for yourself and your children. I would like to invite you to a member meeting we are holding in a couple of weeks. I think you would be a great asset." So she gave me the date, time, and the place, and I went. It was great. I was able to make suggestions of change to the health plan, and they really listened. 10 years later, and I'm still coming. I think the things that keep me coming back are the people and the feeling of making a difference, not just for my kids and I, but also the 190,000 members that have Neighborhood. Having been a part of MAC has also opened up other opportunities for me, both within and out of Neighborhood. I have been the main speaker at luncheons for Right Care and Medicaid, with a room filled with politicians wanting to cut the Medicaid, but after hearing my story and other stories, they decided not to. After being an active member for so long, I was invited to be part of the internal work group called Member Satisfaction Work Group, or MSW. MSW is made up of 4 to 5 other members like myself who are a part of MAC's and Neighborhood's employees, mostly management. It's the place that the issues discussed in our employees It's the place that the issues discussed in our MACs are brought to, given to the department head to work on, and with his and her team. I really believe that the reason that I keep coming back, not only we were listened to as members, but we also were able to work with staff to be part of a solution. At Neighborhood, they listen to their members. They listen so much so that I know if I know somebody who I think would be a good member for one of our committees, I will let Ken and Jackie know. They will interview them, and if they agree, they will allow the person to join the committee. In closing, I would just like to say that it has been a great ride working on various committees, and I will continue to do so until they tell me it's time that I gotta go. Thank you, and I'll pass this on to Rosa.
Thanks, Serena. Thank you both, Jacqueline and Serena, for such a great presentation and helpful tips for recruiting and retaining members in the Member Advisory Councils. I will now ask Margot to walk us through the training aspect of this presentation. Next slide, please. Margot?
Great, thank you for having me. And I'm going to be talking about a training program that we developed for consumers to serve on plan governance and or community advisory committees. Next slide, please. You know, the presentations today really talked about the importance of meaningful engagement. And one of the things that we think is critical is that we include training in that. We can't assume that a person who is an advocate or wants to become an advocate knows exactly what to do when they come into that room as a member of a community advisory committee or on their plan. So the goal of the kind of training is to orient people to each other and to what engagement really is and to what their delivery system looks like. looking at skills that they might need to be most effective in the committee structure, understanding the importance of mutually set goals and interests, that this is not only what consumers want, but this needs to be in light of the context of the plan and how the plan works. And of course, we believe all three of these things makes the likelihood of meaningful engagement more possible. Next slide, please. When we developed the curriculum, we did a assessment of various curriculum that were out there, and we also took a look at some key informants who have actually done this kind of training. We had some experts review our outlines and our content. We talked to plans about what kinds of content they would like to include. And Rosa talked about the toolkit earlier. We applied generic principles from the toolkit around engagement, around participatory meetings, and to really help to orient people well around their role. The philosophy of the training, and this is important, is that we're not only talking about sort of a few slide presentation, but we want to make sure that it's first of all participatory, that it focuses on both behavior and attitudes, and that's a lot about confidence building. We want to make sure that people leave there as considering themselves as a member of a team, not just as an individual person who happens to be on the Community Advisory Committee. And we always struggle with what is nice to know versus what's needed to know. And I think always when we develop trainings, we put so much material in because we think, oh, they're going to need this, they're going to need that, they need to understand this. But we really need to ask ourselves at this point in the introductory component, what is the most important thing for people to know? And to really weigh that very heavily and carefully with folks who are reviewing the curriculum to make sure that you're not biting off more than you can chew, especially because you're not going to have days and days to train folks to be able to sit in a room for that kind of time. Next slide, please. So we had numerous objectives that we developed based on this assessment process. We wanted to make sure that they understood what the demonstration projects were. This was for dual eligibles projects, but we have actually done this for many different kinds of plans since then. We wanted to talk about how community advisory councils work and how they have shaped care and how they could shape care for people locally. Discussing concerns and hopes about being part of the CAC, this is really about normalizing the concerns that people have. Many people fear that they're the only ones who are concerned about how it's going to be sitting next to a doctor. What if other people know what they're talking about and I don't? Airing those things in a safe space, as people are being onboarded, I think is really important and helps to sort of look at the good company that they are in among their peers. Next slide. Next slide, please. Then we got into some content around how meetings work. Those of us who attend meetings all the time certainly understand what an expectation is about a productive meeting, but some of us have no experience in sitting in formal meetings, and so we really need to orient people about how meetings work, what they need to do to prepare for them, figuring out what an agenda is and what kinds of things should be on it. And what Jackie talked about earlier being so important is the feedback loop. How do we make sure that the kind of things that we're discussing here are not just going to stay in this room, but actually have a connection to leadership and governance of the plan, and then how do we know what happens with that when that feedback is provided? Next slide, please. And the final section here, these objectives are about sort of looking at your own qualities as a CAC member. We have a little quiz that we have people do, and we ask people to kind of take a look at what do you think you do well on this list, and what do you think you are challenged by, and normalizing it by saying all of us are challenged by doing these things well, such as listening well, such as being able to respect the majority of the group, even if I personally disagree. And we want them to think about what would be the best skills for their CAC, so that when they get together the next time, they could all reflect on the fact that these are the things that we think are important for our CAC to act to be most productive. And that's based on that quiz that I just talked about earlier. And of course, we repeat the quiz at the end. It's a very brief quiz to allow people to think about, okay, where am I now? How have I changed as a result of being in this training, and what do I still need to be working on? Next slide, please. So this is some examples of activities that we did in the training. As I said, the training is highly participatory, and in fact, the latest version of this training, we actually don't use slides at all in the training. It is really very foreign to a lot of folks who are not, completely comfortable in sort of a office environment. Sort of the idea of a PowerPoint slide is foreign to a lot of us. And so we have a workbook that does have some content in it that we refer to, and certainly there are activities, and I'm going to talk about two of these now. So this first activity is something we do around meaningful agendas, and we have a whole section on what should a meaningful agenda encompass, how would you know if you saw it, and what should expectations be around how an agenda is developed. And I can tell you that this conversation is very interesting, the kinds of comments that we get about, well, I don't think this is good, or I think this is a good one, and to really hear the why people say what they do and how minds are changed as a result of this discussion. And so it's really an example of how the folks in the room can really make some assessments about sort of what's happened in the past or what would happen then in the future as they sort of see their first agenda, what kinds of reactions should they be anticipating. Next slide, please. One other example is this idea of my needs versus all of our needs. So folks that we have trained have come from many different perspectives, and some of them have come from a place because they wanted to get their own needs addressed. And of course, we all want to get our own needs addressed as being part of this kind of committee, but that's really not the purpose of these committees. Certainly, it's important to figure out if the complaint and if the complaint process works well. We want to make sure that if I do complain, that I have a way of there is a way to sort of report that and also sort of consolidate that to see what trends are, and the CAC should be involved in that. But we also need to say how many of the rest of us have this problem too, and as a result, what can we in the plan do about it? What can we in the CAC do about it? And I can tell you that this difference between my needs versus all of our needs can be a heavy lift for some folks who maybe are not accustomed to that. But I can tell you that one of the best successes I've seen, in doing this training is that, one member who came in sort of very, I guess, indignant to sort of suggest that her needs were less important than all of our needs, was really excited and engaged by the end of the training and said, now I realize how my stuff that's going on for me is really a bigger issue about other people who probably have the same concerns. I'm sorry, the slides seem to be advancing, so if you can get back that up, please, that'd be great. So we do have a workshop guide, and that is for trainers. We do a training of trainers that is about, that we've done actually by phone, where we train trainers to actually provide this training. And then, as I said, we have this guide that we pass out to consumers in the room who we are training. And this is the agenda. We do it very effectively in a little less than 6 hours. And people are not tired by the end of the day. I think it's actually a very engaging training. We do a little short couple of videos to break things up a little bit, and we do a short lunch and a couple of breaks, as you can see. Next slide. We do a very simple evaluation at the end of the training. You can see that our scores, this was for the very first training we did in Ohio, the scores were high for this small group, which we were pleased about. Next slide. And people found the training to be very effective and felt that they were more prepared as a result of being at this training than they had been. Some people felt that they wanted to go to the next level in terms of learning more, and some felt that the whole training was helpful and get them to be better prepared for moving forward. Next slide. As I mentioned, some of these people did want some additional materials, and some of them were ready for it, some of them were not. And I think that needs to be a realistic expectation that you have, that everyone needs to have the basic material, whether they're a retired physician or whether they're a person who is dual eligible who has been on disability most of her life. I think everyone needs to be on the same playing field. And some may be interested in taking the next step, but the idea is that all of us here are learning, all of us here are teaching, regardless of what your position is, and really to normalize that across the group, no matter who's in the group. Next slide. So, Rosa, I'm going to turn it back over to you, please.
Thank you, Margot. Before we turn our attention to a few questions and answers, I'd like to take one last poll. What new consumer engagement approaches do you now plan to use to improve your consumer advisory committee? Please take your time to post your results. Thank you.
We will be closing the poll in 5 seconds. Thank you. Okay, so we have the results. 10% answered formal training curriculum. 10% answered overview of plan benefits for health insurance literacy. 1% answered development of ground rules for CAC action. 18% answered skills for effective communication representing others. 4% answered sharing of personal stories. All right, thank you so much.
Thank you all for participating. Now we'll hand the question period to Angela. So please submit your questions. Thank you so much.
Great, and I just want to take a moment to thank our wonderful speakers, Jacqueline, Serena, and Margot. And just a reminder, a recording of the event as well as the slides will be available shortly at www.resourcesforintegratedcare.com. At this time, if you have any questions for our speakers, please submit them using the Q&A on the right-hand side of your screen. All right, so kicking off the Q&A, first question for Jacqueline. Are stipends being provided to dual eligible members? And what about the yearly Medicare spending limit?
Yes, we will be providing stipends, and this discussion has been had with CMS so that we are within our guidelines. And again, we will be providing stipends to this group as well.
And another question for Jacqueline: where did the funds come from to provide the spending for the stipend for attending the meeting?
The stipends come through our admin dollars, and that is how we provide our stipends to our members. We are very we ensure that the number of meetings per year are kept to a number that will keep them underneath where they would have to report them, say, to a government agency, because we wouldn't want to see anyone get into any trouble or lose any benefits. So we do provide the money through neighborhood.
Great, thank you, Jacqueline. Now we have a question from Margot. How would you adapt training for individuals with an intellectual disability?
Thanks for that. I think that you need to really assess what their issues are in terms of their disability. I think, first of all, the training is participatory enough that would allow for different, I think, levels of capacity to gain something from it, because we are less relying on reading and more relying on discussing. I think partnering with someone else for those folks, or making sure your groups are split enough that allows for sort of fuller participation by those folks with intellectual disabilities. I also think that you may want to shorten the training for folks with disabilities to really focus just on some discussion areas, such as sort of your concerns and sort of what's expected of you at a meeting. I think we often assume that someone with intellectual abilities may not be able to sort of handle being in a room with people that don't have intellectual disabilities, but I think that it can be overcome, by separating people into groups where you're well matched and explaining that folks do need assistance. I will share with you that in one training we did, we actually had plan administrators of various types, like Jackie, but and similar, who participated in the training as assisting. So we had a person we did have a person who clearly had very low literacy, and we had a person who was blind, and those staff members were able to assist those people in helping them helping to formulate their comments, or helping them to sort of participate more effectively.
Great, thank you, Margot. Now we have a question for Jacqueline. How do you recruit for diverse representation?
I'm sorry. So again, a lot of the tools used in recruitment come from other members, come from advocacy committees, come from our nurse case managers, and so we try to make it as purposeful as we can, because we want to make sure that everyone is being represented, and it just always works out well. Whether we will go to a community event maybe for Hispanics, or we will go to a community event when we're in need of additional members that may be African American, and we will try to do recruitment that way. But we've always been able to make sure that we were that we had the right amount of number of folks that we were looking for. So a lot of the recruitment is purposeful.
Great, thank you, Jacqueline. Now we have a question for Margot. How do you prevent your training session from becoming an actual consumer advisory committee meeting? Have you set rules that set the two apart?
Yes. Well, first we have ground rules that we all agree on as we start the meeting. But what we found is that happened a lot, where there were topics that were raised or suggestions that were made that were really part of a future agenda, a future meeting agenda, or a future discussion about how they wanted to organize themselves. And so we used a parking lot for that, and they were sent home, the chair and the staff member were sent home, with this parking lot, because many of those topic areas were things that they wanted to do in terms of planning, or something they wanted to discuss about some issue that was arising in the plan right then. So that expectation needs to be set in advance, but I think it's also important to write it down, because those things will percolate, those kinds of things percolate throughout the training, those kind of aha moments like, wait, what about this? And you don't want to squelch that, excitement or engagement, to just make sure that it's addressed at the next meeting, perhaps even a debriefing meeting to the meeting that you just had, the training you just had.
Thank you, Margot. So our next question is for Jacqueline. Are the members that participate in the MACs or CACs allowed to participate for over a year? And do you continuously add on new members throughout the year?
So it seems to be rolling. We do have a contract that we just developed so that folks will be able to be on our committees for 2 years, but we will allow an additional 2 years. It's a part of the contract that we did. But we do find in some cases that the membership will be rolling, because although someone may start off saying, this is something I'd really like to do, after 1 or 2 meetings, they may decide, it's not what I thought it would be. And so that's what allows it to be continuous and rolling. But there is a 2-year term limit with an additional 2 years available if the individual is interested.
Great, thank you, Jacqueline. So our next question is from Margot. Could you talk more about building meaningful agendas on an ongoing basis so that members are providing meaningful input into important systems and quality issues?
I think I understood the question, but let me know if I don't answer it. The litmus test for meaningful agendas certainly is ongoing. One thing that we bring up is that the agenda should be reviewed in advance, and that you should have the ability to provide feedback for that agenda before it is made final. The second is that meetings should not be presentations, but should be focused on discussion. The third is that there needs to be the sense of the feedback loop, which I talked to you about, the idea that what happened to old business, what happened to the stuff that we talked about last time, where did it go, and what was the resolution of that thing. And then the fourth issue is sort of next steps, actions that are going to be taken between now and the next meeting. So I think that, but backing up your question a little further is sort of the sense of sort of what is the purpose of this meeting, and sort of the underlying purpose of this meeting. If it's to inform the group about X, Y, and Z, that's not an appropriate use for a CAC meeting. It's around sort of discuss this, engage consumers in this, help us make a decision around X. But if the litmus test is that it should not be sort of this, we're informing you about this, this, and this. The other thing that people need to also see is that your story, again, these individual stories of people who are on the CAC is important, of course, but remember that that's just one drop of many people's stories. And so the other issue is how is the CAC reflecting and hearing from other members? Is that data from the plan? Is that data from the folks that are living in their assisted living facility? But the idea that our opinions in this room are perhaps the most relevant opinions may be true because we're sitting here, but also may be more emblematic of a more systematic problem that we need to take a look at. So I hope I answered your question. If I didn't, please type it in again.
Thank you, Margot. Our next question is for Jacqueline. Connecticut has over 50 consumer representatives involved in SIM advisory councils, but there are funding limitations related to meals and stipends. Are there other strategies we should explore to sustain participation?
I'm sorry, I missed the beginning part of the question. Could you repeat it, please?
Connecticut has over 50 consumer representatives involved in SIM advisory councils, but there are funding limitations related to meals and stipends. Are there other strategies we should explore to sustain participation?
Sure, I think there could be other strategies that you could explore. So one thing that I would definitely look for is being the largest Medicaid managed care health plan in Rhode Island, although it's very small, we do use a lot of the same vendors. And so I don't think there's anything wrong with going to a vendor and saying, we need you, you know. And so it might be okay to say, could you help us out? You know, we've given you a lot of business and maybe you could help us out. I think that would be one thing that you could do, you know. And another thing, it could be that you could change the style of what your dinner, you know, is going to be, or the amount of your stipend is going to be, you know. And maybe it's not a dinner and maybe it's, you know, snacks, you know, healthy snacks with fruit and water, you know, or maybe it is, the stipend is $15 stipend as opposed to a $25 stipend, you know. And then there's a wonderful organization here in Rhode Island that has been known for writing grants for things such as this. And you could maybe look into writing yourself a grant so that you could keep your advisory committee running, especially if, like myself, you're a firm believer that the stipends and the dinners are a big portion of it. Write a grant. I think that whatever it takes to keep them going, I think we've got to keep doing them.
Hi, sorry, thank you, Jacqueline. So we have one more Q&A question, and this is for Margot. How did you get consumers to agree to an all-day training? Hi, Margot.
Hello. I'm sorry. Hello. Thank you. I had the easy part of being running the training, but not actually having to recruit for the training. But I will share with you what some of my colleagues shared with me about how they did recruitment. We only had probably about half of the people who could have come coming to the training, and we offered to do it over evenings and or weekends, so that we could, let's say, do three evenings over three nights, like 5 to 7 p.m. each night kind of thing, or to do it over consecutive days of the weekend or over 2 weekends. And they opted for having it all in one day. The plan was very supportive and, you know, assisted in helping to facilitate transportation and, you know, obviously having food and getting the space. And I think it required some cajoling and some encouragement from the folks who were doing their outreach to get folks to come, to get them excited about coming. there was, I can tell you that in the room, there was, I think, some regret that people had about, oh, I wish so-and-so were here, I wish so-and-so were here. And frankly, because only half of the folks were trained in Ohio anyway, that could have been, you know, I think that had a real, you know, it definitely affected the outcome simply because when they got back, half of them had experienced this training and half of them hadn't. And I think that may have, I don't know for sure, but I think that may have sort of contributed to some different kinds of expectations once they returned to the table. You know, I also think that the connection with advocacy groups that our contact had, who you know, is a statewide advocacy group who helped to sort of do the engagement work with us, you know, certainly had connections and had relationships with folks, so that it wasn't just, you know, the plan saying, gosh, darn it, you should come, but because of the ongoing relationship that the plan had with an advocacy group in Ohio, that that the Ohio group was really better able to sort of do that sort of cajoling and convincing than they would have if they were complete strangers.
Thank you, Margot. And we do have one last question, and that is for Jacqueline. What is included in the interview for determining eligibility for CAC?
I'm sorry. So it's almost like a job interview, and we had even come up, excuse me, with some short versions of a job application. And so we want to know what sort of experience they may have had, you know, working in the community and or any previous experience at advocacy. And we would take all of that into consideration with the individual's personality as you would with, you know, a regular job interview. And we would make the decisions based on that, you know. Sometimes I would say, you know, I'm feeling this way about this individual or that way, and I'd ask my colleague if he wouldn't mind doing a second interview, or we would just be able to tell based on a first interview if we could do them together, okay, this is someone that we know would work out for whichever advisory committee that they were interested in, and we were interested in having them in.
Thank you, Jacqueline. So I just want to take the time to say that a summary of the Q&A will be available on www.resourcesforintegratedcare.com shortly. And a few final remarks. Please complete the post-webinar survey that will pop up on your screen when you exit the session. If you have any questions or comments, please email rick@lewin.com. The slides for today's presentation, a recording, and a transcript will be available on www.resourcesforintegratedcare.com shortly. Have a wonderful afternoon, and thank you so much for your participation, and a big thanks to our wonderful speakers. Thank you.